Hello and welcome. I'm Dr. Sabina, physiotherapist from LRC Department of DPS Srinagar, and I welcome you all on behalf of Therapy Department LRC. Today, we are celebrating Physiotherapy, Occupational Therapy, Speech Therapy and Pathology Day. The day is an opportunity for us to raise awareness about the crucial contribution these professions make to keeping people well, mobile and independent. So, in this regard, we would like to enlighten our esteemed staff and students across the board about these professions. These are all among the allied health professions, where speech therapy assesses speech disorders and communication problems. Occupational therapy and physiotherapy promote, restore or maintain health through physical examination, diagnosis, prognosis, client education, physical intervention, rehabilitation and disease prevention. On this awareness day, we have chosen two important topics that are stammering and posture. Now, my colleague Dr. Bilal, physiotherapist, will enlighten you about the emerging problem, that's posture. Thank you.
Hello everyone, my name is Dr. Bilal Ahmed. I'm a physiotherapist from LRC DPS Srinagar. As my colleague has given a brief about what is an occupational therapy, physiotherapy and speech therapy day, I would like to take this opportunity to give you a brief about what is a posture and how it affects for long run. So simply we can say the posture is the way we stand, the way we sit and the way how we do work, or simply we can say how we hold ourselves when we stand or when we sit. We had done a rough survey in our DPS Srinagar, so we found that our staff, teachers as well as our students who are having back pain and neck pain due to the wrong posture. So we came to conclusion that around 30% of our staff who are having back and neck pain is due to their wrong posture, the way they stand, the way they sit, as well as our students. Our students also need to carry bags, and the way they sit in the classrooms also affect their body due to the back pain and the neck pain. Now we are going to give a brief demonstration about how we are supposed to sit at work and how we are supposed to sit in a classroom, and also we give a brief about some exercises which our staff as well as our students can do when they are in a classrooms, when they are at home, when they are at work. Now we are going to show you how we are normally sitting down, and that is called a bad posture. After that we are going to demonstrate how we are supposed to sit properly, that is called good posture. Most of the people or most of the staff among us, among the students as well, so we have noticed they tend to slouch when they sitting down like this. So when they tend to slouch and sitting down, they tend to start having this back and the neck pain as well. They might experience also pain in the shoulders. Some of the students tend to slide down while attending the lectures, or some of the staff when they are resting down, they tend to slide down for the rest. This can also cause the lower back pain. Now I'm going to demonstrate how we can sit properly to minimize the impact of this bad posture on our muscles as well as bones. So we are supposed to sit on the chair, make sure the back is upright and straight, the shoulders are in line, hips are around at the 90 degrees and the knees also flexed around 90 degrees, and feet should be resting on the floor. And also make sure the head, they are not tilting up or down. The head is supposed to stand at the center and chin slightly inwards a bit. This is the typical good posture we all must follow, whether we are students, we are the teachers. After explaining what is good and the bad posture, we'll move on to the next demonstration, that is an exercise. So what exercise we can do to minimize the impact of bad posture on our neck? We'll start the neck stretching first. I want you to keep your arms straight beside your body. Your shoulders should be neutral. Okay, head should be straight, chin should be holding in. And you need to bend your neck to one side and hold it with the another hand and pull it down gently where you feel some stretch. It shouldn't be painful. Hold for 10 seconds. Now you're going to repeat same stretch on the other side. Bend your neck, keep your chin in, shoulders straight and pull it down. Hold for 10 seconds. Moving on, we'll do the next stretch. You have to look down to your armpit. Your nose should be pointing down to your armpit. So look down, put a hand on top of the head, pull it down gently, and then repeat on the another side as well. Pull it down, then let it go. Now moving on, we'll do the next stretch, that is basically for our pectoral region, or you can say the chest. What we are supposed to do, you can stand straight, put your hands behind your back, alright, keep your chin in, squeeze your shoulder blades back, hold them tight. The same stretch also you are going to hold for 10 seconds and repeat for 10 times. Exercise what you can do is put your hands on the side, bring your shoulders up Hold for 5 to 10 seconds and make sure your chin is not protruding forward. It is remaining straight and straight. Then drop them down slowly. Again, pull your shoulders up. All right. The last stretch I'm going to demonstrate is basically for your shoulders. So what you're supposed to do, use your right hand, put it on the left shoulder. The another hand put behind the elbow and push the arm in. You need to hold this stretch again for around 10 seconds or relax. Then pull it again in, hold for 10 seconds. This is basically to stretch the muscles behind your shoulder joint. All right, now I will give a brief about the number of repetitions you can do is around 10 to 20 repetitions. You need to hold for 10 seconds. So when you have a free time in between, you can do these exercises in a school or at home, maybe 1 to 2 times a day. And also one more thing you can do is to move around. When you're sitting in one posture or standing in one position for a longer time, you can walk around a bit, you can change the positions, so it will reduce the impact of prolonged sitting or prolonged standing on your bones as well as on muscles. Now Ms. Iram will come from speech therapy department. She will explain about the speech disorders and the interventions they use to improve the speech disorders.
I would like to enlighten you about what is speech therapy. Speech therapy is a therapy which is designed to address speech and language disorders. There are so many disorders, but I would like to discuss about one, that is stuttering, or in layman's language, stammering, because this type of disorder is mostly found in school age group. Now, what is stammering? Stammering is an involuntary interruptions or inability to push a syllable while speaking. This is mostly encountered when speaking words beginning with or sounds produced by letters like b, m, k and g. It is also accompanied by allied symptoms like redness of the face, blinking of the eye, tremor of the jaw. Now before moving on to, I would like to show you a video clip based on stammering. So kindly have a look.
My name is Daniel. I am 7. I have 7 fish. I like to collect rocks and I stutter.
So, who are affected? Stammering is a fairly common problem. As per estimate, approximately 1.4 of the world's population is affected by this disorder. It generally occurs in childhood between the age group of 3 and 7 and is perfectly alright. But it becomes a cause of concern when it extends beyond the age of 10. Statistically, 1 out of 4 children who stammers retains it up to adulthood. Now move on to the causes of stammering. There are a number of causes, physiological as well as psychological. So physiological causes can be inability to control muscles of the organs of speech, or obstructions in the organs of speech, or difficulty in the movement of lips and tongue, or neuromuscular problems can be also there. Stammering in advanced age is also attributed to psychological factors like loss of confidence in one's ability to speak without stammering, or other psychological reasons that can trigger stammering include tense atmosphere at home, weak self-confidence, anxiety, stress. Now, what is the treatment for stammering? Exercises are really effective in the treatment for stammering. Now, I introduce Ms. Nadia from the same department. She will demonstrate some of the most important exercises for stammering.
Hi everyone, I'm going to talk to you about few strategies which can help you to improve your speech. You can perform these exercises early in the morning or during the daytime whenever you are free. So let's begin with the first exercise, that is breathing relaxation exercises. How you can perform this exercise is you have to place your hand on the chest and another hand on the abdomen. Then you have to slowly inhale through your nose. Now you have to hold your breath for 5 counts. Now exhale slowly from your mouth and relax. You have to repeat this exercise 5 to 6 times. Now I'll be showing you another breathing exercise which you can do with the help of respirometer. Dear students, you can bring the respirometer, and with the help of respirometer you can do the breathing exercises as well. You have to hold it between your lips and inhale slowly through your mouth and hold your breath for 3 counts. Now exhale. You can repeat this exercise for 5 to 6 times. This exercise will also help you to improve your breathing capacity. Now, another important exercise is phonation duration exercise. You have to take a deep breath from your nose and hold your breath. While exhaling, you have to prolong the vowels. That's A, E and O. This exercise will also help you to improve your breath control. Please make sure while doing these exercises, you have to monitor your time duration for which you are holding your breath.
Dear students, now the next strategy which can help you is airflow technique. You can perform this exercise by taking a complete breath, exhale a little bit of air, start speaking using the stretch syllable technique. You can initially practice this exercise while reading any paragraph of your textbook. Then you can implement the same technique at conversational level. Let me demonstrate this technique with the help of this paragraph. First, you have to take a deep breath, then exhale a little bit of air. Once upon a time, there was a bee named Bonnie. Bonnie was a cute little bee, but he was brave and wise. I hope students you must have understood. Thank you.
There are also few exercises which you can perform at home is singing, participation in theatre and practicing tongue twisters, as these exercises will also help you to improve your fluency.
Now let's discuss the foods for those who stammer. While there are no particular food that can be used to cure stammering, some foods are known to be beneficial for speech organs like cinnamon, dried dates, almond. They can be taken in small quantities to address symptoms of stammering. Dear students, let me discuss the classroom management for those who stammer. Try to provide them a relaxed environment. Encourage your student to talk to you about fun and easy topics. Teach the student breathing and relaxation exercises. Don't interrupt or speak over them. Speak slowly to your student and ask them questions as much as possible. Introduce the student to small groups and encourage them to read in front of the group. Paired reading will be encouraged both at home as well as in the classroom. Try not to react in a negative manner. Let's discuss the other recommendations for treating stammering. Stammering is known to be aggravated by fatigue, nervousness, or tension. A positive atmosphere at home and workplace is of paramount importance in helping a person who stammers. Above all, stammering cannot be cured overnight. It takes time and patience, but the rewards at the end of it all are really worth the time. Dear students, I hope you must have enjoyed. Thank you so much for watching. Have a great day ahead. Bye-bye.